Through Putting You First, Scottish Care Associate Dr Sue Newberry has been working to enhance engagement and involvement with the independent care sector across the region. The role has included exchanging knowledge and best evidence-based practice amongst partners, as well as identifying opportunities for development.
I think what Putting You First are doing is literally putting the older person and the carer at the heart of what they do. And for us, that means being one of the partners that, for example, if we take an outcomes-focused approach to supporting an older people, the person and their carer, it's about all of us, NHS, social services, care providers, independent and voluntary sectors, all of us working to our own strengths to help that older person achieve what they want and need, and helping them to take responsibility too, so that they remain more independent. We've known this has been coming for some time, and we're in Dumfries and Galloway, we're very aware that already we're seeing capacity of cottage hospitals, community hospitals, care homes, all being quite full. People have got waiting lists for care homes, and I know that there's more and more requirements on care at home. What we're listening to with providers is that people going into care homes are going in when they're slightly older, that they also perhaps have more complex needs by that stage. Similarly with care at home providers working in the community, we're seeing much more complex needs being supported in the person's own home. The forward-looking care and more planning in advance is the sensible way to go, because at the end of the day the older person should have the choice. We shouldn't reach a crisis where perhaps other people have to make decisions. It should be the person. That's what we'd want to do. We'd want to make choices. We'd want to be able to put those plans in place. If such circumstances came to fruition, then we know what will happen, and we're still sort of in control, even though perhaps somebody is incapacitated at that stage. They have made their choice before. So there's a lot of interventions that are actually about talking to older people about what they do want to see happen, what they would like to see, and avoiding those crisis situations happening. I think it's really important, and I'm only here on a temporary basis, so I feel able to make a comment that it's not about sustaining a job or a role. But actually the research shows that if you do involve your partners, including the independent sector, and you all work together as a team, surprise, surprise, the actual resulting procedure or protocol is actually more practical, it actually works easier, everybody's been involved in that consultation process, and it's a robust solution to quite a challenging time that we're facing, all of us together.